Hey guys, welcome to another episode of our channel. Today's discussion will be on cardiovascular and respiratory changes with VO2max. So, cardiorespiratory endurance is related to the cardiovascular and respiratory system's ability to deliver sufficient oxygen to meet the needs of metabolically active tissues, and the delivery of oxygen to active tissue is defined by Fick's equation. Fick's equation states that whole body oxygen consumption is determined by both the delivery of oxygen via blood flow and the amount of oxygen extracted by the tissues. The atrio-venous oxygen difference. The product of cardiac output and the atrio-venous oxygen difference determines the rate at which oxygen is being consumed is VO2max equals to maximal stroke volume into maximal heart rate into maximal atrio-venous oxygen difference. Now, multiple cardiovascular adaptations occur in response to exercise training, including changes in the following: heart size, stroke volume, heart rate, cardiac output, blood flow, blood pressure, and blood volume. To understand the adaptations in this variable, it is important to review how these components relate to oxygen transport. Heart size. In response to increased work demand, the heart's mass and volume increase with training. Cardiac muscle undergoes hypertrophy as a result of chronic endurance training. Cardiac hypertrophy occurs due to greater synthesis of cellular proteins, reduction in protein breakdown, thickening of individual myofibril, increased number of contractile filaments. These are the fundamental adaptation of cardiac muscle to an increased workload. Between the chambers of the heart, the left ventricle changes the most in response to endurance training. The internal dimension of the left ventricle increases mostly in response to an increase in ventricular filling. Increase in chamber size of the heart is highly correlated with VO2max. Stroke volume. Stroke volume increases due to endurance training, and eventually VO2max also increases. The stroke volume increases due to increased internal left ventricular volume and mass, reduced cardiac and arterial stiffness, increased diastolic filling time, and improved intrinsic cardiac contractile function. The graphical representation elicits the relation between stroke volume and oxygen consumption during upright exercise. The endurance athlete's heart exhibits a considerably large stroke volume during rest and exercise than an untrained person of similar age. The greatest stroke volume increase during upright exercise for trained and untrained person occurs in transition from rest to moderate exercise. Maximum stroke volume generally occurs between 40 and 50% of VO2max. This takes place at a heart rate of 110 to 120 beats per minute in young adults. For untrained person, only a small increase in stroke volume occurs during transition from rest to exercise. Consequently, a cardiac output increase occurs from acceleration in heart rate. For endurance athletes, heart rate and stroke volume both increase to increase cardiac output. The athlete's stroke volume generally expands 60% above resting values. Relatively large stroke volume increase in transition from rest to exercise also occur in endurance trained children and older men compared with healthy but untrained counterparts. Heart rate. Aerobic training has a major impact on heart rate at rest, during submaximal exercise, and during post-exercise recovery period. The effect of aerobic training on maximal heart rate is rather negligible. Resting heart rate can decrease considerably as a result of endurance training. Highly trained athletes have resting rate of 40 beats per minute or less. Heart rate during submaximal exercise also decreases, often by about 10 to 30 beats per minute following 6 months of moderate training. Maximal heart rate either remains unchanged or decreases slightly with training. When a decrease occurs, it probably allows for optimal stroke volume to maximize cardiac output. The heart rate recovery period decreases with increased endurance, making this value well suited for tracking an individual's progress with training. The graphical representation shows the relationship between the heart rate and oxygen consumption during graded exercise for athletes and sedentary students. The group of 6 endurance athletes trained for several years, whereas the other group consisted of 3 sedentary college students. The researchers evaluated the students' exercise responses before and after 55 days of training program designed to improve aerobic fitness. The lines relating heart rate and oxygen consumption remain essentially linear for both groups throughout the major portion of the exercise range, whereas the untrained student's heart rate accelerates rapidly as exercise intensity and oxygen consumption increases. The athlete's heart rate rises much less, that is, the slope or rate of change of the HR VO2 lines differs considerably between trained and untrained. Consequently, an athlete performs more intense exercise and achieves a higher oxygen consumption before reaching a specific submaximal heart rate than does a sedentary student. Cardiac output. Cardiac output is the product of stroke volume and heart rate. Cardiac output during maximal exercise increases considerably and is largely responsible for the increase in VO2max. An increase in maximum cardiac output represents the most significant adaptation in cardiovascular function with aerobic training. Maximal heart rate generally decreases slightly with training. Thus, increased cardiac output capacity results directly from improved stroke volume. A large maximum cardiac output distinguishes champion endurance athletes from other well-trained athletes and from untrained counterparts. Cardiac output at rest or during submaximal levels of exercise remain unchanged or decrease slightly after training. Here, the graphical representation shows that the relation between cardiac output and oxygen consumption during upright exercise. It illustrates the role of cardiac output in achieving a high level of aerobic metabolism. In trained athletes and students, cardiac output increases linearly with oxygen consumption throughout the major portion of the exercise intensity range, with the athletes achieving the highest values for both variables. A linear relationship between cardiac output and oxygen consumption in graded exercise also occurs in children and adolescents. For these young persons, increased stroke volume closely matches the added oxygen requirement of exercise during growth. Blood flow. Blood flow to active muscle is increased by endurance training. Increased blood flow results from the 4 factors: increased capillarization, greater opening of existing capillaries, more effective blood redistribution, and increased blood volume. Blood pressure. Resting blood pressure generally reduced by endurance training in those with moderate hypertension. Endurance training results in a reduction in blood pressure at same submaximal work. At maximal rate of work, systolic blood pressure is increased and diastolic blood pressure is decreased. Blood volume. Blood volume increases as a result of endurance training. The increase in blood volume initially caused by an increase in blood plasma volume. An increase in plasma volume is one of the most significant changes that occur with endurance training. Increase in plasma volume is a major factor in the increase in stroke volume. Red blood cell volume also increases, but the increase in plasma volume is typically higher, resulting in a relatively greater fluid portion of the blood. Increased plasma volume decreases blood viscosity, which can improve circulation and oxygen availability. Now, we will discuss about the respiratory adaptation. The respiratory system undergoes specific adaptations to endurance training to maximize its efficiency. Pulmonary ventilation. After training, pulmonary ventilation is essentially unchanged or slightly reduced at rest and slightly reduced at the same submaximal work. But maximal pulmonary ventilation is substantially increased. Two factors can account for the increase in maximal pulmonary ventilation. They are increased tidal volume and increased respiratory rate at maximal exercise. Pulmonary diffusion. Pulmonary diffusion at maximal intensity increases probably because of increased ventilation and increased lung perfusion. Arterial venous oxygen difference. The oxygen content of arterial blood changes very little with training. Even though the total hemoglobin is increased, the amount of hemoglobin per unit of blood is the same or even slightly reduced. The arterial venous oxygen difference, however, increased with training, particularly at maximum level of exercise. This increase results from increased oxygen extraction by the tissues and more effective blood distribution to the active tissues. The increase in arterial venous oxygen difference plays a key role to increase the VO2max. So, we can say that improvement in VO2max following endurance training results from increased in blood volume, increased in cardiac output, and a better perfusion of active muscle with blood. Increase in VO2max with training are largely attributed to increased maximal blood flow and increased muscle capillary density in the active tissues. Increased in arteriovenous oxygen difference is a sign to more effective distribution of arterial blood to the active tissues, which leads to increase in VO2max. As plasma volume increases during endurance training, stroke volume also increases, and as well as cardiac output, which leads to increase in VO2max. Increase in chamber size was only change in left ventricle caused by endurance training, which was highly correlated with VO2max. So guys, if you like this video, please subscribe our channel, share this video with your friends. If you have any questions, give it into the comment box or mail us